I am Dr. Stephen Ataro Ayela, Assistant Director at State Health Monitoring Unit. We have come with a team together with the Resident City Commissioner to inspect the hospital and meet with the people in regards to the complaints that were raised and also the media coverage that came out about 3-4 days ago. Indeed, we held a meeting with the senior hospital staff and followed through the concerns that were raised. Many of them are actually pertinent issues that we observed as we were moving around in the hospital. And also we came up with action points from yesterday's meeting to discuss the key issues that are affecting the hospital performance. In particular, we found out that the hospital compound was bushy, there are garbage all around, and indeed actions were taken, slashing was done today, as well as garbage collection. Moving around the hospital premises, we found that at the staff quarters, there are dilapidated structures, some which were not renovated or refurbished in the recent renovation. And this poses danger to the staff. We also acknowledge that there are some people who are subcontracting from the staff. They are renting inside the hospital premise when they are not hospital staff. And this vice must be stopped. We instructed the hospital administration that this should be stopped. Going to the medicine store, we found that lots of oxygen cylinders are left out, which are being destroyed by the sun and also rain. Some of them are rusty, and this is not right, as well as some beds and other equipment which are left out. An action point is that this must be relocated immediately. Going inside the pharmacy or the medicine store, temperature monitoring is not being done as should be. Stock cards are put aside, not where the supplies are. And the updating is also not regular. So this must be updated immediately. We are glad that we found the garbage collection ongoing near the pediatric ward, but also still in the the drugstore, the storage of items are not ideal. We need to use pallets and the shelves adequately to free space. The ventilation is not adequate and the temperature is high. There's need for ceiling fans or air conditioners to be instituted in this place. Going to the pediatric ward, there is congestion. Too many patients, attendants, and even the caretakers. Really, with that, if a pandemic like COVID-19 or even a Ebola case which is detected, if one contact comes there, many people will be affected. So there is need to decongest this ward, even if it means looking out for attendants to sit in the tents outside and the children who are less sick to stay out while the other ones are given priority. Maternity ward is equally congested. Issues of supply, some of them are missing, but for key essential items, we found them in place. I think the main problem is issues of blood giving sets, which has been challenging, especially in pediatric ward, given the big number of admissions. Going to the laboratory, many tests have been carried out in the claim that the reagents and supplies are not there. But this is a state-of-art laboratory with massive equipment and infrastructure investment. And we are losing time and money by sending samples out, keeping the staffs who are paid not actively working. So the vice of taking samples out to outside laboratory and also fishing in those ones from out to come into the hospital laboratory must stop immediately. Supervision of laboratory staffs to be more intensified, to see that they attend duty, they do the test as recommended, and also each of the units periodically should give status update. For example, the administration should know the stock status in the medicine store and those items which are fast moving or that are not available could be recollected from other facilities which are not utilizing, since this is a regional referral hospital. Coming to the radiology unit, we took note of renovation going on for the planned installation of the CT scan machine. However, it's taken also some time, and the services are not being done majorly. So we need this process fast tracked, and those that need X-ray and other radiological services, including ultrasound scan, should be attended to. Ideally, a room should have been identified where this item is relocated while the room is being renovated majorly. So the head of radiology unit must be responsible to ensure that these services are provided as a continuity. I think the rest of the services my colleagues can share information about. All in all, okay, staff attendance, we've not finalized the human resources staffing analysis, but we take note of absenteeism and some people who are multitasking and working in different facilities. Of course, trafficking patients from the hospital, sending them to private facilities. This must also be put on check because it's not right. My colleague Karugaba will talk about some of the punitive measures that have been taken since yesterday in regards to people that are involved in doing this patient trafficking. Thank you. I'm Dr. Stephen Atara, Assistant Director at Health Monitoring Unit.
So my Assistant Director has said it all, but under my docket, first of all, I'm called the Detective Superintendent of Police Karagaba Corridors. I head investigations of health monitoring in the State House. Adding on what my boss Assistant Director has said, yesterday as we came in, the background is already said, but we are responding to the complaints which came from the public and having been captured by some good citizens, talking about the impunity that is within Mbale Referral Hospital, whereby we are dispatched to come and say that we could put some situation in order, and we arrested 3 security guards who were appearing in the video which was captured by NTV staff, and we are still on hunt for other officers who have been participating in trafficking people out of the facility to the private clinics outside and laboratories and pharmacies and so on. So the hunt is still ongoing, and whoever is caught up across will be brought to book. I think briefly that's my docket.
Do you have their names?
Detective Superintendent of Police Karagaba Collins.
The names of the arrested.
No, I haven't recorded it down yet, since it is still subject to investigations. But we shall be updated at the CPS Mbale. We shall be updating you as investigations progresses. Thank you so much.
Ahmad is my name. I'm the RCC Mbale City. 3 days ago, we received a team of the State House Health Monitoring Unit, headed by the Deputy Director, State House Health Monitoring Unit, Dr. Stephen Ataro Ayela, to come and back up the team in Mbale City to ensure we follow up with the malpractices that has been going on in Mbale City. Earlier on, even before the video which appeared in NTV Panorama program, we have been making a lot of interventions, including detecting theft of drug extortion and so forth in this hospital. As the city monitoring team, we had made an intervention which led to ensuring that some of the culprits are brought to book, especially the other notorious act of referring a patient to a private hospital. I mean, a private quack clinic within the city. If the patient was lured from here, that is going for specialized operation, instead of specialized operation, they mishandled her and she bled to death. That case is with the court. However, the DPP reduced the charges to manslaughter. By this one, I've requested the State House and Health Monitoring Unit, the investigative department, to ensure that they link up with the DPP to see that a person who was referred from a hospital where we have qualified staff by a person who does not have any single qualification on handling that matter can operate somebody to death and then it is taken as a manslaughter. However, I want to thank the State House Health Monitoring Unit, which has actually come to back us up and also guide us on how to take up some of the issues that go around in the hospital. Measures we have taken so far as the Health Monitoring Unit of State House leadership has said include reprimanding those found in those acts, like the 3 security guards who are now in police, and also a person who was masquerading as a hawker, but instead stealing phones from patients, was also arrested, is the 4th in the cells. But also the measures as security we have taken is to ensure that the security manned by the police here is strengthened by ensuring that a new team here, which is free now from the corruption that has been going on here, is brought here, and also the security of the facility to the extent of not allowing every Tom, Dick, and Harry to enter and come out freely. Those are the people who come here to lure patients to go to those work units and private installations where they extort money from, which at the end of the day is shared by those health workers referring them outside there. So from now on, based on the guidance of State House Health Monitoring Unit, we are reactivating the regulation of entering the health unit. When you are coming here, you must be a patient referred, or you are an attendant officially here who may have gone out for an excuse. You are allowed in. However, for visitors coming to visit patients now in the hospital, we have directed the hospital management to ensure they put time for visitors to come in, and then other time should be left for health workers to reduce all the congestion of people who come here to lure patients outside there to go and get fluids. From now on, we don't allow any private vehicle to park inside. If it is of a health worker, the administrator should notify the security to clear it as a vehicle of a staff here, because such private vehicles have been brought inside here to park and then mobilize patients quickly to go to these health units. Another thing is that they have been using borders to swiftly mobilize patients from here to go and land into extortion centers there. We have now directed that from now on, we don't allow borders to park in front of the gates of our health units. These are not parks. These are ways bringing in patients, because if we congest first of all the gate and the ambulance mobilizing a patient who is critically ill, then reaches there, finds borders crowded, he may die in the process. And also, their being there eases these viewers or patients from the health center to go to work, doctors outside there to get mobility quickly. So basing on that, we don't want any more parking of borders in front of our Regional Referral Hospital as a mechanism of reducing on mobilizing stealing patients to go to work, health workers. And also, a stern warning has been issued to the staff to ensure that they go back to their ethics as health workers, because they have vows they vow in the university when they are graduating, that they will have the most empathy to the clients they handle. So we have guided them that to get rich, you don't need to work within just a day. To get rich is a process, and you must get rich from working, not just extortion. Fortunately, some of the staff, when we met them, they have agreed to ensure that this situation now becomes history from now on. My appeal to the general public is that when you also come here and you are about to be fleeced, don't wait to be fleeced before you come out and complain. If a health worker lures you into paying a price on a service you are supposed to get already paid for by government, alert us. That's why from now on, all our phone numbers, the security team led by me will be pasted in all wards, so that in case you have a problem, you call those numbers and we come to your rescue. A clinical officer in the casualty ward who demanded 100,000 shillings for a person who wanted a notification notice to go to Mira to get a death certificate is on the run, but we are still following that one. And a staff also who is in the orthopedic unit who has been luring patients here to go outside to be fleeced is on the run, but we are also following them to ensure that they are brought to book and face the law. The health officer of the city to follow it up, because we cannot allow such impunity to go on unchallenged.
Thank you very much. I'm called the Ojono Bruno. I'm the hospital administrator in Mbale Regional Referral Hospital. Yesterday, we received a team from Health Monitoring Unit together with the RCC, who we had a meeting with the senior staffs. They have observed so many things, as you've heard from them, and there are so many measures and recommendations that they have put in place, which for us as management, we have to take action on. Thank you.
On the issue
and the trafficking patients.
Just like I said, when we held the meeting yesterday with the State House, there are so many do's and do nots and other recommendations which they have put in place. But also this goes to our staffs, that since now the health monitoring unit has come into place, and we have been assured that there is this activity ongoing in the hospital, then it should stop. It should stop, and we have to follow the guidelines and the ethics.
Which activity,
have you been aware?
In particular, which activity are you talking about? When you talk about activity, which one are you talking about?
The activities they are talking about is the extortion, and the trafficking of patients outside.
Have you been aware of this before? Please. Have you been